Hi guys, today's lecture is going to be on sarcoidosis. This is Alex from Salmonella Place. So what is sarcoidosis and what causes it? Sarcoidosis is an inflammatory disease that is induced by a helper inducer T cell of the immune system. The cause is as yet unknown, although multiple theories exist, the most popular being that it is of autoimmune origin. 1 in 10,000 people present with sarcoid symptoms, mostly in women rather than men, which supports the autoimmune theory, and it is 10 times more in blacks than whites. The pathomechanism occurs when large amounts of these particular cells accumulate in one or more organs of the body, particularly the lungs, eyes, skin, liver, and lymphatic system. The cells form characteristic clumps known as sarcoid granulomas and are harmless. The problems they cause, however, are due to their positions within an organ, such as in the epithelial lining of the lungs or in the eyes. What are the symptoms of sarcoidosis? Many times, symptoms do not present themselves until much later in life, even though the granulomas start forming months or even years before a diagnosis can be made. Symptoms usually occur between the ages of 20 and 40, which again supports the theory of an autoimmune origin. Initial symptoms range from mild to severe and depend on which organ has been affected. The general symptoms, however, include fatigue, weakness, aching muscles, swollen lymph glands, fever, lack of appetite, and weight loss. 90% of patients suffer from granulomas in the lungs, which can cause shortness of breath, wheezing, and a dry cough in the initial stages. In more severe cases, the shortness of breath can become life-threatening, in which case a lung transplant is needed. Arthritis can also accompany sarcoidosis, which causes joint pain and yet again proves this disease to be autoimmune, since autoimmune diseases usually come in pairs when improvement is not apparent. When the skin is affected, red, painful nodules are formed that are known as erythema nodosum and can become purple patches of scaly skin, acne-like pimples or cysts. Sarcoidosis of the eyes causes blurred vision, tearing, and photophobia when left untreated. Blindness can follow. Facial muscle weakness or drooping of the eyelid occurs when the nerves of the head or the face are affected. How is sarcoidosis diagnosed? It usually happens by chance, since the symptoms aren't always there. Chest x-rays reveal that granulomas in the lungs or the surrounding lymph nodes. Initial symptoms are subtle, and a differential diagnosis must be overcome so that it isn't misdiagnosed as cancer or tuberculosis. Blood test reveals higher calcium or ACE, angiotensin converting enzyme. A biopsy of the lung tissues using a bronchoscope or a biopsy of the skin or swollen lymph nodes or lymph glands is the best way to form a concrete diagnosis. What is the treatment of sarcoidosis? Many cases are not severe enough for treatment. In this case, a patient is then periodically examined, checked for progression or regression, and is asked to present themselves if symptoms become more severe. Frequent testing can include chest x-rays, lung function tests, and eye examinations. Treatment is started when there are signs that the disease is progressing and or that the lungs have difficulty procuring oxygen. Other reasons for treatment commencement include an ongoing eye infection, a severe joint disease, painful or disfiguring skin conditions, or impaired nerve function. Treatment is usually in the form of steroid drugs, for example, prednisolone. Most people live with minimal interference when on this particular medication, providing that they incorporate a good diet and regular exercise into their daily routine. Within 2 years, a high percentage of people make a complete recovery. However, there is no way to tell if someone will recover forever, regress back into the disease, or continue with it and become progressively worse. The best chance for elimination of the granulomas and decreasing the risk of recurrence is to look after yourself and your body.